A shocking article by two doctors, one a rheumatologist and one a gastroenterologist, was just released, highlighting the biggest problem that Medicare patients and Medicare providers are faced with today and every day. They titled their article, "Why Are We Letting Insurers Dictate Patient Care?" And so in this video, I'm going to share this article with you and show you what these two doctors and really what all doctors want you to know. Now, the subtitle to this article really says it all. And here's what they write. Prior authorization is wreaking havoc on patient health. So again, why are we letting insurers dictate patient care? Prior authorizations that are allowed now and really enforced by insurers is wreaking havoc on patient care. The two docs in this article, Dr. Jung, gastroenterologist, Dr. Desir, a rheumatologist. And here's what they write. When patients are suffering from life-threatening illnesses or debilitating health conditions, the only thing they say that should matter is delivering appropriate evidence-based treatments in a timely manner. For that, they write, patients rightly turn to us, their trusted physicians, for expert guidance on the best course of action. And all of that, of course, makes common sense. Yet they go on to say this, all too often, and I experience this as well in our profession, in the insurance business, as we see insurance companies doing this to patients. They say, yet all too often, insurers insert themselves into the equation. Why? Because they're allowed to today. As a result, restrictive policies like prior authorizations can interfere with patient care and lead to dangerous and painful outcomes. And that's exactly what we see. Prior authorizations interfering with what the doctor is saying. And what's the outcome of that? Oftentimes, it can even be death. Let's keep going. They write, the process of prior authorization allows insurers to review doctors' orders and decide whether they will cover prescribed services. Okay? Such policies, now listen to this, very interesting. Such policies were initially, so when the prior authorization concept came into being, they initially were established to help reduce healthcare costs by controlling patient access to more expensive or investigative medications, treatments, and therapies. But insurers have taken it too far. And that's a reality, overruling physicians' recommendations and defaulting to rejection of, routine, evidence-based, and often life-saving care to prevent any expenditures. So are the pre-authorizations now accomplishing what they were intended to? And absolutely not. Okay, why? Because even routine items, things that are evidence-based, where it's clearly something that the patient needs to save their life, those things are also now being denied through the prior authorization process. Let's continue on. The docs write, today, prior authorization has become one of the most widespread challenges in medicine. Okay. Dr. Jung tells a story of one of her patients who takes a biologic to manage her Crohn's disease. Remember, some medications are small molecule, those are chemically derived, and others are biologic. They're coming from a living organism. So she is taking a biologic, typically more expensive, to manage her Crohn's disease. She writes that that patient typically suffers from a breakthrough symptom, meaning some type of a symptom that emerges while she is getting treatment. So she suffers from breakthrough symptoms before her next infusion is due. So we asked for authorization from her insurer to increase her dose so she wouldn't have these breakthrough issues. Her insurance company required several letters to document and justify this change. In other words, what the doctor felt was not sufficient enough. The breakthrough issues were not sufficient enough. She goes on to write, this process resulted in a 1.5-month delay before she could access the medication she needed to effectively manage her disease. Again, prior authorizations causing delays. She goes on to write that while she, the patient, waited for prior authorization, that 1.5 months, and continued to experience GI and musculoskeletal symptoms, her condition impacted her ability to perform her job and enjoy her life. Now, the other doc in the article, Dr. Desir, tells the story of one of her patients. And again, Dr. Desir is a rheumatologist, and she says this about this person. This patient suffered from systemic lupus erythematosus. Hopefully I'm saying that correctly, called SLE, systemic lupus erythematosus, the most common type of lupus. This person, after taking medication for 10 years, experienced flare-ups that exasperated her incurable rheumatic disease. Fearing the medication was no longer working, her rheumatologist switched her medication to an FDA-approved treatment, but her insurance company denied coverage because the patient did not have a specific antibody test result that was required by the insurer for that particular medication. So what happens? They're adding rules to this particular treatment plan that was necessary for this lady as prescribed by her doctor. Again, that's what they have now the power to do. Let's keep going. It says the patient has to remain on a therapy that provides less than ideal benefits and is now enduring multiple rounds of glucocorticoid treatments to help mitigate her painful symptoms. Hey, if you found this video helpful and if you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, now they say this, very interesting. They say the state of play, so the present condition of the medical environment, healthcare environment. So the state of play for prior authorization puts the insurer, not the physician, in the driver's seat for patient care, and that is wreaking havoc on patient safety and well-being. And again, we see it every single day. Who's in charge? It's the insurance company, not the physician. Unfortunately, these doctors write, these examples are just a drop in the bucket of frustrating insurance barriers. According to a 2022 AMA, American Medical Association survey, listen to this, virtually all physicians report prior authorization delays to access necessary care for their patients. Okay, 4 out of 5 doctors report that the burdensome, lengthy prior authorization process sometimes or often leads to patients abandoning their doctor-prescribed treatment. Why? The frustration of waiting and denial and those delays. 4 out of 5 docs say this is a huge problem today. Another 1/3 of physicians reported that the process of prior authorizations has led to a serious adverse health event for patients. Such events could include extreme pain caused by not being able to receive the right medication, especially for rheumatic diseases, or hospitalizations due to a flare-up of inflammatory bowel disease, of course, with the GI situation. Another report, this came from the Kaiser Family Foundation, puts out a lot of great things. I enjoy reading their reports. They found that approximately 60% of insured adults experience issues when using their insurance coverage. What's the issue? Again, most of the time it's going to be a prior authorization problem. Let's keep going. This is particularly true for patients struggling with rheumatic diseases like arthritis, which is a leading cause of disability in the United States, as well as a range of GI diseases and conditions such as Crohn's disease, ulcerative colitis, and colon cancer, the second most common cause of cancer death in the U.S. For these patients who are really very vulnerable, delaying or denying access to care often leads to disease progression. So things get worse because they couldn't get the treatment at the right time. Let's keep going. They write prior authorization should be, I love this statement, prior authorization should be used for what it was originally designed for, which was what? Assessing insurance utilization in situations of what they call statistical outliers, which means they were really designed to control situations that were beyond the norm, really far out there in extreme cases, so there wouldn't be really a waste. But now they're denying care that would not be in the outliers. They're saying just normal care that would be experience-based, where they should be getting, but now they're not, because we've given the insurance companies the right to be able to go beyond what the original intention of prior authorizations were designed for. Let's keep going. So it says, with the objective of decreasing unnecessary procedures. Again, this is what their original intention was for these outliers, to decrease unnecessary procedures, imaging, and treatments. All right. So again, outside the norm, not within the norm. So what they're saying is true reform is going to continue to support what prior authorizations were designed to do, to keep kind of having a waste for those things that are real extreme, not the norm, right? So while reducing the scope of services, treatments, and medications that require prior authorizations and increasing transparency between health insurers and physicians to minimize the delays in care. Almost done here. Hey, if you're finding this video to be helpful and you would like to learn more about Medicare, you'll notice up here in the right-hand corner, there's an eye. And if you'll click on that eye, it's going to take you to a 20-minute workshop. I see people make mistakes all the time, and we don't want that to happen to you. And that's why we're giving you free access to this workshop. So go ahead, click the link, and learn more about Medicare. They go on to say it is also critical to protect continuity of care by ensuring prior authorization does not interrupt a patient's course of treatment, meaning for days or sometimes even for weeks. Why? Because that we have more progression of the disease, sometimes even things even more serious than that, even death because of these delays. And then they go on to say this interesting. Last year, Congress, now listen to this, came close to passing critical legislation to reform the prior authorization process that targeted Medicare Advantage beneficiaries. But the key here is they came close. It didn't happen yet. And so these docs really are pleading, saying that it's time for legislators to revisit this issue once again. And then finally, beneficiaries must be protected from big insurers who overstep their bounds with intrusive prior authorization policies with no data to support their rationale. Why aren't they approving them? Because it's going to cost them money. And so they don't have supporting evidence to say, no, you're not going to get that service. They just simply don't want to pay for that. And so they write, when insurer policies, I thought this is so interesting, when insurer policies, meaning the policies and procedures by the insurance company, turn into de facto medical decision-making for patients, which means what? So in reality, a matter of fact, now we have these insurer policies. Their rules now are decision-making for patients with commercial insurance or, listen, Medicare Advantage plans. And then they close with this plea: there must be guardrails to protect the evidence-based care recommended by physicians and the health and well-being of our patients. So when there's evidence-based decision the doc's going to make, then there shouldn't be a prior authorization process for that. It's something that simply needs to happen. Yes, let's have prior authorization for those things that are beyond the norm, the extreme kind of cases. And so now there's been this great abuse. And so just in closing, the reason this matters for our channel, why I even share this with you today, is because when people go on Medicare, they really only have two choices. They're going to enroll in Medicare A and B and get a supplemental plan to fill in the financial gaps that Medicare didn't cover, or they're going to enroll in A and B and have A and B replaced by a C plan called an Advantage plan. And so about half of all people are going on Advantage plans. 40% of all people are going with supplemental plans or some kind of secondary insurance. 10% just do A and B only. But for those people that choose Advantage plans, what they often don't realize is they not only just enrolled into a plan that may have a zero premium or a low premium, a lot of perks, but it also comes with it a lot of prior authorizations, because they say right now that 70 to 72% of the services that will be required on that Medicare Advantage plan will be subject to prior authorization. So the doctor doesn't have the final say-so. You don't have the final say-so for sure. It's that insurance company with the power of the purse that has the decision through pre-authorizations to say, no, we don't believe you need that. They'll delay that. They may deny that. They may say, no, we want you to go to therapy. We want you to try medications first before we we approve that surgery. So there's a host of things that they can do to interfere and to cause delays or even denials of necessary health care. Now, as we compare Medicare Advantage to a supplemental plan, that supplemental plan can never run interference at all, for they have no say-so whatsoever. Because if your doctor says you need it and Medicare says they'll pay for it, then that insurance company, that supplemental company, has to follow. In fact, a lot of them even put on the cards, no pre-authorizations required with supplemental plans. So when a person makes a decision to use their benefits, Medicare benefits, through that Medicare Advantage system, they're now going to be subject to pre-authorizations, and there's a whole host of problems that come with that. We've read about a couple of those, of course, and we see that every day in our business as well. When people choose a supplemental plan, they're not going to experience the insurance company running any kind of interference whatsoever.